One such muscle which connects the humerus, and on the other side it connects the radius. So you remember what was the term that we were using for the arm? The term that we were using for humerus, we were using for arm. What was that? What was that particular term? What? Huh?
Brachium.
Brachium, correct. So brachium was the term that we were using for the arm. And now this muscle, yes, I can hear you. So when I say that one side it is connecting to the brachium and the other side it is connecting to the radius, so the name of the muscle must be brachioradialis muscle. Right, so this muscle is brachioradialis muscle. Right. Anyways, so what I was saying, that number one, we have learned that it is an extensor muscle. If it is extensor carpi radialis longus, number one, it's an extensor muscle. Carpi means it is attached to carpal or metacarpal. Third thing is radialis means it is somewhere related to the radius or the radial nerve. Something must be there. And the next thing is longus. Okay, that means it is a very pretty long muscle. So here I tell you that it is originating in the lateral supraepicondylar ridge of humerus. So once again in the similar region. Okay, but last time it was more on the proximal side. This time it is not so. It is just lateral supraepicondylar ridge of humerus. And where it is going? So the word was carpi. So remember, this is connecting to the dorsal, because see, we are always talking about the dorsal aspect, isn't it? So this thing is connecting to the dorsal aspect of the base of second metacarpal. Okay, it is connected to the dorsal aspect of the base. This is the second one. Okay, so dorsal aspect of the base of the second metacarpal. So this is the second metacarpal, isn't it?
Yeah.
So this was the first metacarpal, this is the second metacarpal. So its base in this region, it is connecting. Clear? So let's see how this muscle is going to look like. This muscle naturally, or I'll use some other color over here. This muscle will start from here in this region, and then this is going to go like this. So this will be the first metacarpal over here, and over here this is going to be the second metacarpal. So it is going to go to the base. Its base will be somewhere over here in this portion. So this is going to connect to the base of the second metacarpal. So this is, suppose, how this muscle is going to look like. So do you realize that this is present laterally? Do you realize that this is present laterally? Laterally means, do you realize now that it is related to the radius? So from the word extensor carpi radialis longus, what you can understand is, number one, it's a extensor muscle, because now you understand that it has gone from here, it is going from here. That means this time, if this muscle is going to pull, so what will happen? Your hand is going to move in this manner, extension manner. So remember that now we are really talking about the extension of the, yes, so lateral supraepicondylar ridge of the humerus to the dorsal aspect of the base of the second metacarpal. So what will be its action? Its action is extend at the wrist joint. See, movement should be, I told you that most of the time movement is at the insertion point. So whenever it is going to pull from here, so it is going to move in this manner. So there is going to be extension at the wrist joint. Clear with this?
Yes.
So if we are using some word like long for, say, longus, then we can use another word, short. So you know what word do we use for something which is short? The word that we use for short is brevis, brevis. So if this is extensor carpi radialis longus, so the next muscle name should be
Extensor carpi radialis.
Correct. So it is going to be extensor carpi radialis brevis. So where does it start from? Now here I tell you, Remember that near the lateral epicondyle of humerus, or at the lateral epicondyle of humerus, you remember that last time we talked about a common flexor origin. From one area, all the muscles were originating. In the same way, correct. So that was the medial epicondyle. Now this time we are going to talk about the lateral epicondyle. So this time, if I talk about this lateral epicondyle, say I'll use this color, somewhere over here suppose, then we should call this as the common,
Common extensor origin.
correct. So this is going to be the common extensor origin. Now what happens is, this is going to start from here.
So this is going to be present anteriorly or posteriorly?
See, all these muscles that we are discussing today, they are all present in the posterior compartment. Okay, they are all present in the posterior compartment. Understanding? So, if I talk about this muscle, so where will this muscle go? It's very easy to remember. Last one went where? To the second metacarpal.
Second,
So this one will go to the,
third.
of course, it's such easy thing. So last one went to the second metacarpal, so I'll put this one to the third metacarpal. So do you think this is, you need to mug up this thing?
No.
No. I don't know why people keep mugging up anatomy. So there's nothing to...
They teach it like that at college also.
Yes. So,
One after the other, they keep on playing and try and say that we should also memorize.
no, there is no need to memorize. Just follow this technique. Okay. So always there is a sequence present. You should try to follow the sequence, and it becomes so very easy. So we have learned that this muscle is extensor carpi radialis brevis. So, and you understand that its action will be similar to the last one's action, that is extension at the wrist. Okay. Now let us talk about the next one. The next one that we talk about, that is, you can say, I tell you first the name actually. Extensor Digitorum Minime. So can you tell me Minime? It's not like mini me. I'm not mini. So what do you mean by the word MINIMI? Minime. What do you think it must be? Try to apply some brain over here. Minime, small, correct. And digiti is digit. So can you tell me what is the author talking about? What are we talking about?
The little finger.
Correct. We are talking about the little finger. Basically, we are talking about the finger which the person shows for peeing purpose, isn't it? So yes. So of course we are talking about the little finger. So when we talk about this finger, this is which one? This is the fifth metacarpal. I mean, if we are talking about the metacarpals, so this is going to be the fifth metacarpal. So when we talk about this extensor digiti minimi, now apply some common sense and tell me, thinking, what should be the connection, attachment point? It should originate from where and it should insert to where? It's very simple.
It will originate from common extensor origin.
Okay, very good. It will originate from the common extensor origin, and where it is going to join?
At the base of the metacarpal.
Correct. So it is going to join at the base of where?
Fifth metacarpal.
Correct. So you are saying it is going to join at the base of the fifth metacarpal. I'll just make a slight modification over here. This is going to join at the extensor expansion of the fifth metacarpal. Now this is a very tricky word, isn't it? That what do I mean by extensor expansion? So first let's have a little bit idea related to extensor expansion, then we'll return back over here. So first let's have some basic idea related to extensor expansion. Imagine I talk about the finger. Let's choose anyone. I'll say let's talk about the third, you can say metacarpal. Let's talk about the third one. Third one, which means which one I'm talking about? The longest one, isn't it? Primarily the middle finger. All right. So let's see. Or I can we can also call this to be the say, okay, if it is the metacarpal present or carpal present, suppose I'm talking about, achha, why we talk about carpal metacarpal? Let's talk about directly the phalanges. Okay, phalanx. So we will see that there is a proximal phalanx, there's a middle phalanx, and there is a distal phalanx present. Yes. So let's see what do we mean by this special terminology. So over here, if I'll draw this over here. Suppose this is the distal phalanx. This is suppose the middle phalanx, and this is suppose the proximal phalanx. Now you will see that whenever we talk about the extensor digitorum tendons, there will be some muscles, extensor digitorum muscles. Okay, we'll discuss about it. So when we talk about their tendons, so let us suppose that the extensor digitorum tendon is, I'll use this color, this extensor digitorum tendon is moving in this manner. Okay, so it is moving in this manner. Now what happens? It develops or it goes inside a special band over here. So this band is like this. Like this. So this is the band. Alright.
It will cover the what?
Of course, this is going to act like a sheet over here. This is going to cover. Actually, what happens? On the distal ends of the metacarpals and along the phalanges of the 4 medial digits. Okay, 4 medial digit means these 4. This, no, except for the pollex, except for the. Are you there? Okay, everybody here? There was a network disconnection. So I was saying that you see, when I talk about these 4 things, the 4 digits, that is these medial digits. So they must be getting some tendons over here. 4 tendons will be present on this side. Now these 4 tendons, they are going to flatten out. Okay, the 4 tendons, they are going to flatten out, and they form something called as extensor expansion. So what is extensor expansion? Let's see. It is the other name for this is dorsal expansion, or this is also known as hood. Okay, now it is a triangular tendinous aponeurosis. Last class we discussed about aponeurosis. So this is also such a tendinous aponeurosis that wraps around the dorsum and the side of the head of metacarpal and proximal phalanx. Okay, head of metacarpal and proximal phalanx. So how it works? See, number 1, suppose I tell you that one such tendon is coming like this. This tendon is coming like this. See, if this is the tendon present, so it goes like this, and then it is going to spread. So it goes like this and spread. Okay, distal phalanx, it goes like this and it spreads. So it is going like this, and then it is wrapping. If this is the finger present, then this band is going and one branch goes like this, and if this is going, then another branch goes like this. So this entire thing comes up like this and wraps, connects with this surface. So if I will draw this, you will see that this is the thing which is coming like this, and this is going on the other side. Okay, this is going on the other side. Portions. Okay, when this is spreading out, on this side, these two are called as the lateral bands. Okay, when the arms of the Y, this is forming a Y like structure, so these are called as the lateral bands. And this tendon which is moving into it, this one which is moving inside it, this is called as the middle band. So this one is the middle band, and these two, they are the lateral bands. And what is this? This is basically the extensor digitorum tendon. Now, do you realize that this is a flat portion present over here, a flat portion which is connected to two types of muscle. These portions, actually they are connected to two types of muscle over here. One muscle which is present in between the bones. So the term for the bone that we use is osseo, and since this muscle is present between the bone, so these are known as very good, interossei or interossei. Another thing which is present, that is the muscles which are present over here, we call them as lumbricals. So over here there will be lumbricals and the interossei present over here. Like for example, if I say, suppose this is the second lumbrical, then this is going to be the second dorsal interossei. Okay, then in the same way this side there is going to be the third dorsal interossei present over here. So in this way, these are their tendons. Okay, these are their tendons who are going to this region. Now this region, this portion, this flattened portion which is present over here, this is the portion of extensor expansion. This is what we mean by extensor expansion. And remember, this is also called as the hood. Okay, this is also called as hood. Understanding? Like for example, if we will see to it from the side view, so suppose this is the suppose these are the three bones present over here. Like I have drawn three bones over here. So what you are going to see, one is coming from here and is spreading on this side. The other one will be also present on the other side like this, that Y wala portion. And then you will see that the extensor digitorum tendon is basically coming like this. So this is going to go like that. This is correlate with this portion, extensor digitorum tendon. And now I'm going to make the hood. So how was the hood? One portion from here, this was basically moving down. If you remember, this portion, they were forming, wrapping it up. This portion is basically wrapping it. So this is going to form the hood or the extensor expansion. And over here, if this was the dorsal surface, this finger is like this. So if this is the dorsal surface, that means this is the palmar surface. So these are some of those muscles over here, suppose, and this is going to join with the palmar surface. Understanding? From here, this is connected to this. Say for example, this is a palmar ligament. So it is connected to the palmar ligament over here. Clear? So this portion, this is going to form the palmar ligament. So let me make the palmar ligament over here like this. So it's connected to the palmar ligament. So this is how they are arranged over here. So what do we see? that the extensor digitorum tendon, it is trifurcating into 3 bands. You will see 2 lateral bands that unite over the middle phalanx to insert into the base of the distal phalanx, isn't it? These 2 lateral bands, they are going to fuse over here and insert into the base of the distal phalanx, and then there is present one median band, this median band, that inserts into the base of the middle phalanx. Now you will see that if interossei and the lumbricals, they contract, okay, if interossei and lumbricals, they contract, there is going to be flexion at the metacarpophalangeal joint, but there will be extension at the proximal interphalangeal joint and distal interphalangeal joint. If these muscles are pulling, okay, if these muscles are pulling, so muscles are present like this over here of discussion. So having understood this movement, let's talk about the rest of the muscles. So till now we have discussed about number 1, brachioradialis. We have discussed about extensor carpi radialis longus, and we have also discussed about extensor carpi radialis brevis. Now and one more thing we have discussed, that is about the extensor digiti minimi. So extensor digiti minimi, where does it move? Okay, where does it move from? It moves from the same position, correct, the common extensor origin
to the extensor digitorum extension of the third metacarpal.
You call it as the extensor expansion of the which digit? Fourth thing, it is minimi, isn't it?
Oh, yeah, fifth.
Correct. So this thing, it will arise from somewhere over here, and this is going to go like this, and then this is going to go over here to the minimi in this manner. Then over here one more muscle that we will talk about, that is simply extensor digitorum. You remember we have been talking about extensor digitorum only. We have discussed about extensor digitorum over there, if you remember.
Flexor digitorum.
Over here.
Yes.
This was the. Remember we were talking about the extensor digitorum tendon over here. This was trifurcated and all these things. We discussed this.
Yes.
So now we will talk about what was that extensor digitorum. So extensor digitorum, again it is going to have a common origin over here. Okay, it will be having a common origin over here, like common extensor origin from here, and then where is it going to go? It is going to go to all the medial 4 digits extensor expansion. Okay, so it is going to go to all the, say for example, again it starts from here, and this is going to go to all the 4 digits extensor expansion. Medial 4 digit, mind it, don't put it into the thumb. So once we have discussed about this thing, so do you realize, so what all we have discussed? Number 1, we have discussed about the brachioradialis. Okay, then, and you, from the name, just as you are speaking the name out in your mind, from the name only you should try to deduce the information. So brachioradialis, in your mind you should go brachioradialis. Okay, so brachioradialis. Next one that we have discussed, that is extensor carpi radialis longus. So the next one must be extensor carpi radialis brevis. Then the next one that we have learned, so and if you remember, extensor carpi radialis longus to the 2nd digit. So brevis goes to the 3rd digit. Now it comes up directly fifth. So which one goes over there? It is the minimi. Correct. Extensor digiti minimi. So do you realize, according to our this picturization, don't you think gradually we are moving towards ulna? We started from the radialis side because extensor carpi radialis longus, it was the name, and now we have gradually moved towards ulna. So can you tell me what should be the name? Apply some common sense.
Extensor carpi ulnaris.
Very good. So the name is so simple. It is extensor carpi ulnaris. It's that simple. So if I talk about this extensor carpi ulnaris, now here comes up that $1,000,000 question, that where will it originate from? So
Again from the common extensor origin.
okay, but over here actually it is not exactly the common extensor origin. It is from the lateral epicondyle of the humerus, or chalo, let's, for easy calculation, let's consider it to be same place over there. And where will it go? You know, it is going to go again to the fifth metacarpal, because ulnar side what is present? The fifth metacarpal present. So it's once again common sense. So it is going to again start over here, and it is going to go to the dorsal aspect of the base of the fifth metacarpal. So this is moving towards the ulna, and it is going over here, and then it is again going to go to this portion. So do you observe one thing, that have you those, you know, childhood days, have you played this game that, you know, suppose there are these fingers you have taken, and suppose you close this finger, and then you close this finger, and then you close this finger, you won't be able to detach these two fingers. Have you played those games in the childhood? No. You know, this used to be a very nice trick. Many like elder brothers will come up and they will always play this trick with us, that, you know, whenever it is like this, and suppose all the fingers are joined like this, you can actually detach them. Okay, so if this is present over here, you can still detach them. If this is present over here, you can still detach them. And if this is present over there, you can detach them. But if this is present like this, you will never be able to detach this. Okay, you can anytime try. So I always remember this by observing this situation. Do you observe that there is no dedicated muscle present for this one?
Fourth.
Yes.
Fourth metacarpal.
Yes, the fourth metacarpal, we are not learning anything, isn't it? So it is either it is going for all four medial, one is going for all four medial, that's the muscle. So you cannot say muscle is not going, but it is like either muscle is common for all, otherwise muscle is dedicated for this one, muscle is dedicated for this one, and this one goes missing. Okay, so this is something you should observe over here, a very nice thing. Now all these muscles that we have discussed, all these muscles, they are present in the superficial layer. Okay, so you see, when other students they read this, they think that, oh my god, so many muscles we have learned. How many muscles we have learned? Actually, we have learned actually 3, 4, 5, I think 5, 6 muscles we have learned over here. So people start thinking that, oh my god, there are 6 muscles present, but you don't need to think how many you are learning. You should always go in sequence. So we started from the radius side, so you should start like that. Okay, so you should start the way we started. First we started from here. Yes, and you know, it's also easy to remember. The reason being, last time when we discussed about this portion, so all the muscles, they started over here and they ended over here. So the next connection should be some muscle which starts over here and ends over here. Only then a proper connection will maintain, and automatically the name will come up in your mind. And since we are talking about this portion, so you always start from here. So this portion you always start from here, and you know the name. And after that, you know, this bone is radius, so you know what the name is. 2 muscles will be coming up. After that, you know that if we are going for the second one, the second one and the third one, the next one will be the fifth one present over here. And after this, you will see that you have come down more towards the ulna, so you know the next name of the muscle. And of course, there is no other option other than to go in this finger. Okay, so you see, one. After that, when you talk about radius, over there 2 names come up. So three,
Longus and brevis.
longest and brevis, so three names come up over here. Then one, of course, one is going for second. How what? Which one?
Digitorum. Extensor Digitorum.
Extensor Digitorum, of course, but one is going to the second one, third one. So the next one should be, of course, the fifth one, and the name comes up as Minime. So that becomes the fourth name. And after that comes up, you will see you are moving more towards the ulnar side. So that means next thing comes up, that is the ulnaris, and that becomes the fifth muscle. So if you think in this way, then you can find that these names are so easy. And then I have also told you that there is one muscle which will completely overall all the four medial ones. So that was the palmaris. Was it?
Yeah.
Was it palmaris? No, it was digitorum. It was this one that we have discussed, which is going to all and is forming these things after trifurcation. So, is it very difficult? No, never think like that, that oh my god, there are 6 muscles present, what to do. Don't think like that. Just think logically, step by step. So now let's proceed ahead. So these were all the muscles which were present superficially. Now we talk about the deep layer. Now this deep layer of muscles, I'll make another similar picture. Say this is once again, this is the bone, and this is going to be, this is the ulna, and that side there is going to be the radius, like this. Okay, like this. I'm not making all of them, all the details. So the first muscle that we are going to talk about, this muscle starts over here. Okay, it starts over here at the lateral epicondyle of the humerus, and after that, where is it going to go? It is going to go to the lateral, posterior and anterior surface of the proximal third of radius. That means it starts from here. Suppose it starts in this region, so it starts over here in this entire portion, and then where it is going to go is, it is going to go like this. It is going to go like this. So it is going even to the anterior surface. So this is going to go to the lateral, posterior and anterior surface of the proximal third of radius. That means it is gripping the radius almost completely, except for the medial surface. It is gripping the radius. So, and on the other side it is attached over here. So by looking at the direction of the fibers, can you tell me that what will happen if this muscle gets pulled? These fibers, they are present from here, suppose somewhere over here, okay, and they are coming like this. They are coming in this manner. So this is the way they are present. So if it is getting pulled, then what will happen? Your hand becomes rotated. And you know what is this position called as? When in your anatomical position, if this portion comes up, okay, the anterior part comes up dorsally or moves upward, anterior part, this is called as a supine position. Correct. So this muscle's job is to make your hand supine position. So what should be the name of the muscle? Very good. So the name of the muscle is supinator muscle. So it's such a easy name, supinator muscle. So it originates in the lateral epicondyle of the humerus, also radial, collateral and annular ligaments, if you remember, and also the crest of ulna, because you see it's covering these portions. And then it is going to go to the lateral, posterior and anterior surface of the proximal third of radius, and it supinates the forearm. So it's so simple. Now the next thing that we will talk about, this muscle, it is going to begin at the distal third of ulna. Till now we have been all talking towards the elbow joint, proximally. Now we will talk about the distal third of ulna. So from distal third of ulna, posterior surface, another muscle starts up, and I am going to tell you the name and you are going to tell me what it is doing. The name of the muscle is extensor indices. Okay, extensor indices. So which one is your index? That's not your index. Index finger, when we say, yes, is the index finger. So that means from where to where this muscle is going? This muscle is moving from the, I told you, from the distal portion.
Distal third
Correct. Distal third
of the ulna.
of ulna. Okay, distal third of ulna. So let me draw this over here. Suppose this is the ulna. So, and after that, suppose over here the rest of the things will be present as usual. So this is your first finger, index finger, like this, like this. So over here, this muscle, it begins over here, posterior surface of the distal third of ulna, and then it is going to go to the indices, isn't it? Indices means where? Going to the extensor expansion of the second digit. Yes, which digit? Second digit. Yes, extensor expansion of the second digit. Like this. So this is extensor indices. Now we'll talk about 3 more muscles. Now you have to remember these names, and the rest of the things are going to be easy for you. One is, do you watch this thing, Indian Premier League, IPL? Okay, you have heard of IPL?
Yes.
Yes. So if you have heard of IPL, then remember, we will not talk about IPL over here. We will talk about APL, we will talk about EPL, but we will not talk about IPL. Okay, yes. So we'll talk about APL, we'll talk about EPL. Understanding? So what is APL? APL, abductor pollicis longus. EPL is extensor pollicis longus. So apply some common sense and apply those concepts that I have told you since the last classes, and tell me, when you hear the word abductor pollicis longus, what do you mean by that?
Pollicis means thumb.
Correct. Pollicis comes from pollex, thumb.
And abduction will help in abduction, and it is a long muscle.
Okay, so abductor means it will help in abduction, and it's a long muscle. Then can you tell me what is EPL?
Again, extensor pollicis.
Correct. So it's the extensor pollicis longus. Acha, if there is an extensor pollicis longus, then there must be, if there is extensor pollicis longus, there must be
Flexor pollicis longus.
no, flexor out of question. We are discussing today about the extensor compartment. So if there is
Extensor pollicis brevis.
very good. So here comes up, you have only deduced the name of the other muscle, extensor pollicis brevis. So if there is abductor pollicis longus, extensor pollicis longus, then the third muscle that comes up, that is extensor pollicis brevis. So these are the 3 muscles that we are going to discuss, and they are very easy. See, abductor pollicis longus. So first of all, so you understand that it is going, and it's you don't need to again mug this up. Again, you can understand, till now we have talked about this finger, this finger, this finger we haven't discussed, and this finger. But even this finger was getting neglected. So when it comes up to your mind that okay, pollex is neglected and you are talking about extension, so of course the name that comes up in your mind, that is extensor pollicis longus. And if extensor pollicis longus comes up in your mind, you will remember EPL, and then you can remember another thing is present, APL. See, all are going with vowels, A, E, I, O, U. IPL goes on in our country, okay, Indian Premier League, and we are not supposed to talk about that. Let's talk about the other vowels. EPL you have already deduced. So the other vowel that we have got, that is APL. So if EPL is extensor pollicis longus, you know that there will be abductor pollicis longus also. And if you know EPL, extensor pollicis longus, then you know the name of the other muscle, that is extensor pollicis brevis. Correct. So if I talk about, so remembering these or recalling the names of these muscles should not be very difficult. Right. So over here, when we talk about this abductor pollicis longus, insertion point though must be clear to you. That is base of the first metacarpal. Yes. Now, where does it originate? That portion I'm going to tell you. It always originates in the posterior part of or posterior surface of the proximal half of ulna. Okay. Proximal part of radius and the interosseous membrane. So if I talk about abductor pollicis longus, see, abductor pollicis longus, it starts from here, posterior part of the posterior surface of the ulna. Then it is going to cover the radius also, like this, and then they are going to go to the base of the, correct, they are going to go to the base of the first metacarpal. It's so simple. And if this is abductor pollicis longus going like this, the next one should be extensor pollicis longus. And extensor pollicis longus, it goes from the posterior surface of the middle third of ulna. So this was posterior surface of the proximal part of ulna. If you have learned about the proximal surface of ulna, the next one you should learn about the middle third of posterior surface of middle third of ulna. So it will start from here, and this is going to go to the base of the distal phalanx of the thumb. Okay, so distal phalanx will be over here, its base. So it should be, I should use some other color. It should be arising somewhere over here, okay, and this is going to go to the base of the distal phalanx over here. Of course, the dorsal aspect of the base of the distal phalanx of the thumb and posterior surface of the middle third of ulna. No confusion? Right. And then the obvious one comes up, that is extensor pollicis brevis. Now when you have used the word brevis, that means this muscle must be short. Correct. So common sense, it should be proximal third, middle third, or distal third. Correct. So it should be distal third of, now this time one thing you should remember, that is in the distal third of radius. It should be in the distal third of radius. You know why distal third of radius? Because distal third of ulna is already booked. You can remember in this way. This distal third of ulna, if you remember, it was already booked by indices. So how can it go and attach over here? So the only place which is left on the distal third, that is the posterior surface of the distal third of course, radius. And where is it going? It is going to the base of the proximal phalanx of the thumb. So that means this will start from somewhere over here, the radius portion, and then it is going to go over here. Okay, base of the proximal phalanx of the thumb. So understood this portion? So when we talk about all these muscles, we have discussed about the superficial layer, and we have learned in what sequence you should start reading about this. So there is, let's have some easy recap of what we have discussed over here. So first one was, we start from here, from this portion. So this one is going to be the
Brachioradialis.
Correct. So brachioradialis. That means the next one should be related to radius. So you should remember, we are discussing which compartment? We are discussing which compartment today?
Extensor.
Yes. So correct. Extensor carpi radialis longus. That means the next one should be
Extensor carpi radialis brevis.
Correct. Extensor carpi radialis brevis. Then the next one. So if you are going for radialis, that means longus is going to which finger?
Second metacarpal.
Second metacarpal. And brevis goes to
Third metacarpal.
third metacarpal. That means I told you that game. You are supposed to skip this. So the next insertion point should be
Middle
the little finger.
finger.
Correct. Digiti minimi. Now you see you have moved towards which bone?
Ulna.
So the name of the muscle should be?
Extensor carpi ulnaris.
Correct. So this becomes the, so how many muscles are you counting? How many muscles?
It was 5.
Five.
5.
So there is one more that we are missing. That is the one which is going overall. Yes. So it is just the digitorum. Extensor digitorum. So this was about the superficial. And also remember, you should never forget this, that I'll use some other color over here. Over here, there is present a thin fascia which is connecting from this region to this region.
Extensor retinaculum.
Very good. This is the extensor retinaculum. Just it's the add-on. So this was about the superficial layer. Now we talk about the middle layer. In middle layer, what do we have? We have got one that twisted muscle which started from here and it came over here, gripping the radius. Correct. It was the supinator muscle. And after supinator muscle, I told you that whenever you are rotating your finger, the next thing that comes up, that is towards this one. So what was this thing?
Index.
Indices. So extensor indices. After this, you should think about which tournament?
I.
Correct. So what are the names which come up?
APL and the EPL.
Correct. APL and the EPL. And if EPL is present, then the third muscle should be?
Extensor pollicis brevis.
Correct. EPB. So extensor pollicis brevis. So one is abductor pollicis longus, extensor pollicis longus, and extensor pollicis brevis. So you see, if you think that way, then in superficial layer there are 6 muscles you have discussed. Then in the middle portion there are 2 muscles, so 8 muscles you have discussed. And then we have learnt these APL, EPL and EPB. So basically you have learnt today only in the extensor compartment 11 muscles. So if you think 11 muscles, it will be like, oh my god, 11 muscles. But actually these are nothing. You should just think with cool mind in a proper orientation. And it will be like cakewalk. It will be very easy. So since we have discussed this portion, now let us proceed ahead and let us talk about some more things. Over here, we have discussed...
Could you give me a 5-minute break?
Sure. One more thing. If these things are clear, then remember, if I'm going to show you this thumb portion actually, then over here, from here, what passes is the EPL, okay, in this region. In a thin person, I think it will be more prominent. So what passes over here is the EPL. You can also feel it basically in your pollex, in your thumb. So this is the EPL, and over here there is present the EPB in this region, and also the APL will be present. But anyways, over here you will see that there is a depression present. So basically this depression which is present, so what happens when the thumb is extended? Okay, when the thumb is extended, at that time a triangular hollow thing appears over here between the tendon of the extensor pollicis longus medially and the tendons of the extensor pollicis brevis laterally, also along with abductor pollicis longus as well. So this thing, this portion, this is called as anatomical snuff box. Okay, this is what we call it as anatomical, I'll write it over here, anatomical snuff box. So if you remember our previous lecture, then you must remember that anatomical snuff box's floor is found by over there which bone is present? Scaphoid is present and trapezium is present. Okay, so the floor of the snuff box, anatomical snuff box, is formed by trapezium and scaphoid, and later on you will read that even the radial artery is also passing over it. Okay, so the radial artery passes. So this is the portion. Now, in case you are thinking that what do you mean by the thumb extension and flexion and all these things, so for that just understand this thing. These are very simple, but you have to know this. Suppose this is my thumb present over here. Now when I'm going to do like this, okay, this movement, so when I do like this is abduction. When I do like this is adduction. Understanding? This, so it is basically this. So abduction, adduction. Now if I'm talking about this is extension, this is flexion, extension, flexion. Now
Is it not the other way around? Like this one should be abduction.
no, over here, that is why I'm saying this. Okay, this function you should remember. Only then later on all the muscles that I'm going to tell you, that will be clear to you. This is you are flexing, this is you are extending, flexion, extension, and this is abduction, adduction. Okay, abduction, adduction, like this. Then there is one more function present for this thumb, that is when you are bringing it towards the fifth metacarpal, I mean this little finger, last finger. So when you are doing this is called as opposition. Okay, you are opposing it. Oppose, like oppose. This is opposition, and when you are bringing it back again over here, that is reposition. Reposition. So you are bringing it back to the position. So this is reposition. This is opposition. This is and if you are not touching this, if you are like relaxing, then you're like over here. This is the situation. So this is